Hello, my name's Siobhan Rogan. We've all heard the term millennial, but how many of us have given a lot of thought to any great extent about how this generation born between 1983 and 2003 will shape our profession going forward? Over the past few years, a number of things have helped sharpen my focus to this very subject. In terms of HSE services, the one I lead is fairly new, having been set up just over 3 years ago. 2 years ago, we appointed assistant staff to join our growing multidisciplinary team. 60% of the staff we appointed to these Band 3 assistant roles were new graduates, educated to master's level in clinically relevant subjects and in their first job. We were delighted, and they are fabulous. Shortly after they arrived, our assistants announced to our senior nurses that they could do their job and wondered why these clinical posts were not open to individuals educated to their level. The difference between a professional qualification and being educated to a particular level in a subject was explained, and everyone's different roles and responsibilities in relation to patient care was outlined. Experience was also mentioned as a relevant area, but it really made me think, what makes a professional a professional, and how do we embrace the talents and skills of this I can do anything confident population that are entering into our workforce and help them contribute to and develop world-class, safe, effective healthcare? While I was training and coming up through the system in what I shudder to refer to as the old way, things were very different. A hierarchy existed, and there was an expectation and indeed an acceptance that you knew your place and didn't question it. If the consultant or nursing officer came to the ward, they spoke only to the nurse in charge. Medics, nursing officers and other professionals that came onto the ward were all recorded on the daily report as official visitors and only spoke to the nurse in charge. This was still happening in 2005, and I've no idea when it changed, but I can only hope that it has. Worryingly, this was my first experiences of what was referred to as multidisciplinary working, and the hierarchical approach was not conducive to disciplines learning to work together. In some ways, many of us are possibly a little traumatised by how we were treated by senior staff, and now suddenly we are the grown-ups and our newest recruits are suggesting that they can do our job. I can conclude that times have definitely changed. We've went from a generation that was often reluctant to have the confidence to make a decision and who instead preferred to escalate everything up the line, to a workforce that are willing to take on responsibilities and do things regardless of role or professional qualifications. We need to think about how we embrace this enthusiasm and confidence in a way that is safe and effective going forward. We also need to ensure that we build their resilience so that they are more fully equipped to tackle all the problems that the future will hold. Regardless of your political views, I think it's fair to say that Mr. Obama went into a very established institution and transformed it in a relatively short period of time. One of the things that he done at the beginning of his presidency was to surround himself with great people, some very solid and experienced, wise people, but also lots of new graduates. I think this is important. The answers to today's problems sit with our new and yet to qualify registrants and our graduates. We have created the problems, they will find the solutions. How do we embrace their I can do your job attitude and put that to good use? Healthcare is a very complex area. Without our administrative colleagues, patients would not see us. Without our cleaning staff, theatres would not be used for surgery. Healthcare can only be delivered by a team. No one profession has all the answers, and in my experience, there's plenty of work and room for everyone. Nurses should not be threatened by this. We need every nurse to have the confidence and enthusiasm that I've just referred to. Nurses form part of a much wider multidisciplinary team, and no individual or discipline should view themselves as more important or better than any other. Individually and collectively, teams of clinicians from a range of professional backgrounds work together towards one common cause. We need to ensure that professionals all have a shared, solid value base and vision. One of the most damaging things that one profession can do is to run down another profession, and there should be no place for it in 21st century healthcare. We need to talk about how we work with other professions as an intelligent network to collectively deliver safe, effective clinical care. This will ensure that the whole truly is greater than the sum of its parts, Intelligent networks are more important than modern-day health service hierarchies. In my experience, other professions often have more respect and a greater appreciation for nursing and its contribution than nurses sometimes have for themselves. We need nurses to have more confidence and pride in ourselves and our profession. At the risk of sounding needy, the first colleagues to ever tell me that I had something to offer were not nurses. I should add that lots of nurses have and continue to champion and support me in many ways every day in my career, and I'm very grateful for them and appreciate them. As a profession, I believe we could all do more to individually and collectively look out for each other. We need to support, develop, encourage and mentor our colleagues at all levels. We also need to hold each other to account. Leadership at any level can be very rewarding but a lonely place, and people like to cut the tallest poppies. My advice is to surround yourself with good people who will celebrate your successes and also be honest with you, and try to be that person to both your nursing and other colleagues at all levels every day. To further enhance our profession, we need to address the disconnect that I believe exists between policymakers and frontline staff. I would anticipate that most nurses working in acute clinical settings will know they should be bare below the elbow, but do they know the context to this guidance? Do they realise that that practice came about through a combination of a nurse noticing a change in a patient's condition, infections being detected, incidents being reported, root cause analysis being undertaken, research being undertaken, policy being developed to inform practice, and a host of other steps in between? Or will they say, RQIA said so, or even more worryingly, just in case RQIA do an unannounced inspection? Having worked in RQIA, nothing frustrates me more. It was only while working in RQIA that I developed a fuller understanding of the relationship between policy, practice and governance, and how every individual member of staff working in our health service at the front line ultimately contribute to policy development. I think an understanding of how policy is developed and how it informs practice earlier in my career would have benefited my practice. My vision for our service is that each member of staff working in our team can link their everyday practice to the relevant policy, legislation, guidance and standards that so many people work so hard to develop. I want to see nurses writing into patient notes things like risperidone 0.5 milligrams prescribed for short-term management of aggression in autism as per NICE guidance. Nurses need to engage in and influence policy. We need frontline staff driving innovation on the ground and those driving innovation strategically to meet. If we don't do this, everyone's wasting their time. We need knowledgeable, confident, enthusiastic, innovative nurses at all levels to work alongside our colleagues in organisations such as the Department of Health, the Health and Social Care Board, the Public Health Agency, the National Institute of Clinical Excellence, and a host of others to help inform practice and policy. There are people there that want to hear our views and who need clinicians to present solutions to the dilemmas. We need to share them. Professionals need to know what people care about. We need to co-design and co-produce services with patients, not for them. Healthcare is part of a much wider network. It's all about interconnectedness. We need to work and view our contribution as an important, essential and equal part of an intelligent network. For me, nursing uniquely combines biological, social and psychological approaches. It is by definition the biopsychosocial approach that others are striving towards. Nursing undergraduate training provides an excellent foundation for biopsychosocial approach to care. Registrants need to build on this solid foundation throughout their career. It is my view that postgraduate nurse education and skills development is fundamental to improved outcomes for the patients we see and treat. Healthcare is constantly evolving. We're finding out new things about our population and evidence bases are emerging to support new intervention and treatments. Nursing needs to be at the forefront of this. In addition to clinical skills, we need nurses trained from the outset in leadership, managing change, and in actually taking responsibility so they can become the rounded clinical leaders of the future. We need nurses who have the confidence to stand over their own assessments and plans of care, ensuring that decisions are based on the best available information at that time. We also need nurses that can accept that sometimes they will get it wrong. Nurses, like all disciplines, need to be able to identify learning and make changes to practice based on this. Nursing needs to further develop a career structure that promotes progression as a clinician. I suspect the majority of people study nursing so they can work with patients. It's very difficult in some specialities in Northern Ireland to progress in nursing and remain clinically focused. There are much more opportunities to progress in management, and this imbalance needs addressed. The specialist, advanced and consultant nurse frameworks and guidance should help with this. We now need creation of an advanced and consultant nurse roles to help translate these frameworks and guidance into practice. There are great graduates out there who want to become nurses. Having worked alongside the nurses in our team for 2 years, 2 of the assistants we appointed with master's level education have told me that they didn't know that nursing could be like this. They've told me that had they known, they would have studied nursing. We need to look at how we are recruiting into our profession. Are we adequately showcasing the breadth and depth of nursing as a career to potential applicants? Perhaps graduate entry nursing should also be an option. There are great people out there and our profession needs them. I should also point out that some of the individuals that came into our service with master's level qualifications 2 years ago in assistant roles have now decided on a change of career, and they've applied to become nurses. I cannot wait to help mentor them through their studies, and I know they will be fabulous. This is, after all, the generation that are most likely to influence and deliver my future healthcare. I'm keen to invest heavily and make sure that they're great at what they do. Thank you.